Hi everyone, welcome to What's Up Doc, your prescription to be healthy and happy. And it's me, Dr. Didoy Lubaton. Today I want to talk about one of the top cases that I see inside my clinic, and maybe you experienced it before or you know someone who experienced it too, and it has been bugging a lot of people. I'm talking about urinary tract infection, or what they commonly say as UTI. It's a common infection of the urinary system, and it's manifested with painful urination. Sometimes you'll have fever or malaise, meaning you don't feel well. Some people, in severe cases, would have bloody urine or even back pains. And a lot of people get sick with this one. That's why I want to share this to you now, so that you could get to avoid some pain or absence in your office, or overall feeling of wellness. And I want to share to you how to avoid urinary tract infection. If you want to know how to avoid it, you want to understand first why it happens, or how you would develop urinary tract infection. I'm going to give you five top reasons why people develop urinary tract infection. Number one, you don't get to drink a lot of water. Talking about your hydration. Some people develop urinary tract infection because they don't have enough water in their system. Urine, your wee-wee, is one of the top detoxifiers of your body. And some people that I know who develop urinary tract infection don't drink a lot of water. You'll know your hydration status by the color of your urine. The more yellow and cloudier your urine is, the more you need to take a lot of water. The goal is very, very light yellow urine. Hopefully it's clear. And my advice is you want to take a lot of water hourly. Frequency is better than volume. So I take 1 to 2 or 3 glasses of water every hour, and that would really help you in managing urinary tract infection or even preventing it. So number one, you gotta have good hydration. You gotta have good water intake. Second reason why people get UTI is they don't go to the restroom often. Yes, when the urine is pooled in your urinary bladder and it stays there for a long time, sometimes the bacteria from your urinary tract goes up into your system and multiplies. When there is stasis of your urine, you have to empty it frequently. And I'm talking about going to the restroom to pee every 3 to 4 hours. Try to evacuate it and release, and so that the infection will not happen in your urinary tract. So go to the restroom every 3 to 4 hours. I know someone who goes to the restroom in the morning, and the next time she goes to the restroom is in the evening, and that's why she develops a lot of UTIs in a span of a few months. And go to the restroom often. Number three, you want to check your diet, your nutrition. If you're eating a lot of salty food, a lot of processed food, a lot of meats, a lot of dairy, that is very acidic to your body. And one of the best ways the body takes out acidity is through your urine. So if you are very acidic in your nutrition, it forms acidic urine, and it promotes bacteria growth. It promotes growth of microorganisms in your urinary tract. That's why you produce the infection. So if you want to avoid urinary tract infection, you want to balance out your nutrition. Try to avoid salty food, especially the processed one. Hold off on the maalat, yung mga salty food talaga, lalo na mga chips. Balance it out. If you do take a lot of, even chocolates, lots of sweets as well, the salty and the sweets, try to lessen them. And if you want to try to balance it out, kung hindi mo mapigilan talaga, you take a lot of water with it. Okay? So because if you eat a lot of salty and sweet type of food, you'll notice that your urine is very yellow. Also note on those people who are taking a lot of supplements, those who take oral supplements, those who take lots of protein shakes, please do a lot of hydration, lots of water into your system, because any excess of them will be flushed out through your urine. So it's very important also that you manage your nutrition. Okay? Fourth way on how to avoid why you get urinary tract infection is your hygiene. As I want to especially talk to the women. Women have a very unique urinary tract. You have a very short urethra. That's why you guys develop urinary tract infection more. The men usually develop a lot of UTI when there's a lot of manipulation, or even the undies, the undergarments are not clean. Hygiene plays a role. Want to talk to the couples? If you do some love making, you gotta wash before and after doing your thing together, and that will help you avoid urinary tract infection. Okay, hygiene. And lastly, I see a lot of people who develop urinary tract infection because of underlying causes. For example, those people who has high blood sugars, those people with increased prostate gland hypertrophy, meaning the prostate gland is big. It hampers the urination, and there's stasis in urine. That's why you develop urinary tract infection. Some people would develop urinary tract infection also, aside from the sugar, from the diabetes, sometimes from the prostate gland, sometimes when there are kidney stones, or when there are stones in the urinary tract, in the urinary bladder, in the ureters, that also would cause urinary tract infection. And if you want to heal it, if you want to prevent it, you gotta treat the underlying cause. If the sugar is high, you gotta bring it down. You gotta control the hypertrophy of the prostate, the increase in the size of the prostate. You gotta control it. And if there is urinary stones or kidney stones, you got to alkalinize your urine. You gotta take a lot of fruit juices. You gotta have a lot of hydration. And a special note to those people who may have UTI or suspect that you may have UTI, you might want to consult your doctor. Okay, don't take antibiotics on your own. Please do see someone or get some checks. Urinalysis would be very good for you, so that we could give you the appropriate ways to do it. Some tips on the natural and holistic ways. Again, you gotta increase your water intake. You gotta go to the restroom often. Check on your hygiene. Treat the underlying causes. And I hope this episode is very helpful for you. If you know someone who may need to hear this, tag that person and share this video to that person. I love that I get to give practical advice, especially with those people who, most common illnesses that I see in the clinic. And I hope you get to forward and pass on this information if this helps you. Once again, this is Dr. Didoy Lubaton for What's Up Doc, your prescription to be healthy and happy. I will see you again. God bless you.